Okay, so if we're going to do foot and ankle joint assessments, this is how I like to look at it. So what you want to do is have your patient prone, and then we're going to go just sequence all the way down to the first ray. So the first thing we're going to look at is calcaneal eversion and inversion. And you can do this with either hand, but have them in this position. You're going to stabilize here, and we're just going to take that thenar, hypothenar, we're going to grab the calcaneus, and we're going to move them into that eversion, inversion, back and forth, see what it's doing there. The second thing you're going to do is look at subtalar. So what we want to do to really isolate subtalar is grab that calcaneus, isolate it, take that inside hand and take your second ray, and we're going to find that navicular bone. Grab your navicular, and then you're just going to do like a towel wringing motion, looking at supination, pronation, right? So we can see that kind of there, back and forth, back and forth, back and forth. Third thing we're going to do is we're going to stabilize again at calcaneus to see what mid-tarsal inversion and eversion looks like. So this one's kind of your pinching grip, grabbing a piece of paper, and we're going to swoop in and we're going to grab that the tuberosity of the fifth met. And then my force and direction is kind of this diagonal line here, like a 45-degree to the tibia. So we're just going to invert, evert, back and forth, back and forth, back and forth like that. The one difference with that I will say is that we want to see what it feels like when you take them all the way into plantar flexion. So take that calcaneus, grab it, go all the way up, plantar flex. That should be pretty rigid. It's not going to move a lot because we want that rigid lever for push off during gait, running gait, normal gait, and terminal stance. If you dorsiflex them up, you should feel a lot more motion here versus here. And then finally, I'll grab that first ray. I'll plantar flex them all the way so we slacken flexor hallucis longus, right? So we can really isolate and look at joint mobility of that first MTP. And then if you want to, you can swoop it into that dorsiflexion, and we can look at dorsiflexion and plantar flexion of the first ray, again, to see how that thing's moving. But now, just remember, you are going to be tightening that flexor hallucis longus, so that'll be different than this. So again, to recap, just go, work your way down. Start with calcaneus, inversion, eversion, subtalar, pronation, supination, mid-tarsal, inversion, eversion, and then your first ray back and forth too.
Okay.
Bingo.
Got it.
So now let's grab a foot and do it.